kung magkandak ko gamay interview ni mo ma'am about si mong thorax and lungs.
Yeah.
By the way, ma'am, ako din si nurse di siya may. Pwede na malingkod, ma'am?
Okay lang.
Lang ko gamay mga pangutana, ma'am. So, ako'y gamay pangutana, ma'am. So, okay na ba, ma'am? So, naka-experience ba ka, ma'am, of difficulty breathing or a loss of breath?
Wala ko pa try.
Wala, never. Next, ma'am, is do you have chest pain or is the pain associated with a cold fever or deep breathing? Chest pain?
Wala. Wala ko try ko dan.
So, paano, ma'am? Do you have a cough?
Oh.
Okay. Yes. So, when and how often does it occur? Wala-wala?
Oh, magwala-wala siya. Kumpara na siya basta at manata.
Pwede mo rin dry throat o nana. So, do you produce any sputum with your cough?
Sometimes.
Lima, anak, sometimes. So, sometimes. So, what, sa may color niya, ma'am?
Green.
So, how much sputum do you cough up? Hindi naman, estimate, ma'am.
Basta may small lang.
So, how does someone increase or decrease recently? Increase ba siya or decrease? Decrease. So, does the sputum have an odor? Baho ba yung ang sputum, ma'am? Hindi lang. So, do you wheeze when you cough or when you are active?
No.
Hindi. So, diri ma'am, do you have any gastrointestinal symptoms such as heartburn, frequent hiccups, and chronic cough? Napaka ni ma'am, heartburn,
Ano?
hiccups. So, ano ma'am, have you had prior respiratory problems? Wala. So, have you ever had any thoracic surgery, biopsy, or trauma? Wala po. So, have you been tested for or diagnosed with allergies? So, are you currently taking medications for breathing problems? Naka-take ko tag medication nun, ma'am? Other prescription?
Medication.
Any treatments for respiratory problem? Wala. What? So, have you ever had a chest x-ray? No, mo good ko to. Okay, 1, 2, 3, go. So, naka-survey na ba tawag chest x-ray, ma'am? For tuberculosis?
Yes, the chest X-ray.
So, nagkakuan ba ka, ma'am? Have you had any other pulmonary studies in the past? Nagkakuan pa ni? Good. So, have you recently traveled outside of the Philippines?
No.
Wala.
Okay.
So, is there a history of lung disease in your family? Wala. And, kuan, ma'am? Did any family members in your home smoke when you were growing up? No. So, is there a history of other pulmonary illnesses or disorders in the family, like asthma?
Wala.
So, can you describe, ma'am, your usual dietary intake?
Rice, dayon. Chop suey.
Vegetables.
Water.
So, have you ever smoked cigarettes or on any
Never.
tobacco? Wala. So, wala. So, if the client sa iyo, basa mo na. Sa the client reports a history of sige, cut. So, nag-expose ba ka, ma'am, to any environmental condition na makaapekto sa imong pagginawa?
Wala.
Wala. So, baka nag-eskwela, ma'am. Naka-on ba ni ma'am? Nagasurag ba ni siya o mga smoker ng Eskulahan?
Mismo kay sa mga school.
Okay. So, do you have, napakay difficulty performing your usual daily activities? Kanina mo pag-usay, mag-isip mo ginawa, ano lang?
Normal lang.
Okay. So, what kind of stress are you experiencing at this time? Sa karon, sa mga stress?
Stress sa schoolworks. Lots of schoolworks.
So, how does it affect your breathing?
Ay, di mo siya ma-effect sa...
Wala na nakapekto. So, last, ma'am, is nag-use ba tag herbal medicines or alternative therapies? Wala. Okay. So much for that, ma'am. Maura to ako mga pangutana about sa mga Thorax and lungs. And thank you kayo sa pagbabag. So, in collecting the objective data for the thorax and lungs assessment is first, you should prepare the equipment needed for the physical examination, such as the examination gown and drape, and gloves, stethoscope, and light source, and mask, skin markers, and metric ruler. And second is do the proper hand hygiene. Also, provide privacy for the client and ask client to pull her or his put on his or her gown, and then explain to the client the procedure and keep your hand warm to start the physical examination of thorax and lungs. So for the for the general, inspect the nasal flaring and first up breathing. Second is observe color of face, lips, and chest. Second, inspect the color and shape of nails. For the posterior thorax, inspect configuration while the client sits with arms at the sides, and stand behind the client and observe the position of scapulae and the shape and configuration of the chest wall. Next is observe the use of necessary muscles. Watch at the client breaths and note use of muscles. Yes. Next is observe use of accessory muscles. Inspect the client's positioning and note the client's posture and ability to support weight while breathing comfortably. And for palpation, palpate the tenderness and sensation. So palpation may be performed with one or both hands, but the sequence of palpation is established in use your fingers to palpate for tenderness and warm pain or other sensations. Start toward the midline of the level of the left scapula, and then move your hand left to the right. So it is in the over the apex of the left lung, and then move your hand left to the right, comparing findings bilateral. So move symmetrically in downward and out to cover the lateral positions of the lungs at the bases. And second, for during the palpation, palpate the crepitus, or the crepitus, also called the subcutaneous epicema. It's a crackling sensation. So it's like bones or hairs rubbing against each other. and then that occurs when air passes through the fluid of exudate while using your finger. Next is palpate surface characteristics. So put on gloves and use your fingers to palpate any lesions that you notice on the client. During inspection, feel for any unusual masses. Next, palpate the fremitus or use the ball or ulnar edge of one hand to assess the fremitus or vibration of air in bronchial tubes transmitted to the chest wall of the client. As you move your hand to each area, ask the client to say 99. Assess all areas for symmetry and intensity of vibration. So next is assess chest expansion of the client. Place hands on the posterior chest wall with your thumbs at the level of 19 or T10 at the spine of the 8 or the 10th rib like a butterfly here on the lungs of the client. So pressing together a small skin fold and observe the movement of your thumbs at the client and takes a deep breath. Next is percuse for tone, starting at the apices above and the scapulae and across the tops of both shoulders. Percuse intercostal spaces across down in comparing sides using indirect or mediate percussion. And percuse to the lateral aspects at the bases of the lungs and compare sides. So note areas of resonance and hyperresonance or dullness. So next is percuse the diaphragmatic exertion. So first, have a patient take a deep breath and fully exhale. And then percuse the level of the diaphragm and mark it using the color marker. And have patient take a deep breath and then hold it and then percuse the level of diaphragm and mark it again and measure the distance between the two marks and perform the assessment technique on both sides of the posterior thorax. And next is for the auscultation. Auscultate for breath sounds, noting location, the anterior, posterior, and lateral. So to best assess lung sounds is you will need to hear the sounds as directly as possible. Do not attempt to listen through clothing or a drape, which may produce additional sound or muffled lung sound that exist. So to begin, place the diaphragm of the stethoscope firmly and directly in the posterior chest wall at the apex of the lung at C7 to the bases of the lungs. Ask the client to breathe deeply through the mouth for each area of auscultation, each placement of the stethoscope. And the auscultation sequence is so that you can best hear inspiratory and expiratory sound. And be alert to the client's comfort and offer times for rest and normal breathing. Fatigue is becoming a problem. So the normal breath sounds is in bronchial. It is our loud, high-pitched, and hollow with a short inspiratory and long expiratory pace. And then, normally heard in the anterior neck and nape of neck posteriorly. So, bronchovascular, moderate sounding and medium pitch, which they call inspiratory and expiratory. So heard over first to second intercostal spaces, and between scapula posteriorly. And then listen to one full respiratory cycle at each site. So note normal abnormal and adventitious sounds. If adventitious sounds heard, have patient cough and listen to see if sound has cleared. And next is auscultate the for adventitious sounds. And the crackles, fine or coarse, pleural friction, raw, wheezing, sibilant, and sonorous. For the testing for the abnormal voice sound is you should auscultate for voice sounds over chest wall and bronchoscopy. Have patients say 99 clearer transmission of spoken voice sound over affected area. And then auscultate for voice sounds over chest wall. Agony have, or let's say it's called egopony. Have patients say E will sound like A over affected area, so it is abnormal. And whispered pectorilico, have patient whisper 1, 2, 3, and clear transmission of whispered voice and sound over affected. So for inspection for the anterior thorax is inspect the shape and configuration. Have the client sit with arms at the sides, so like this, and then stand in front of the client and assess shape and configuration. And this is to determine the ratio of anterior-posterior diameter to transverse diameter, or normally 1 to 2, costal angle, spiral deformities, and condition of skin. And next is inspect the position of sternum from anterior to lateral viewpoints. Next, watch for the sternal retractions and inspect for the slope of the ribs from anterior and lateral viewpoints. So, and next also is inspect for the quality and pattern of respiration, noting breathing characteristics, the rate, the rhythm, and the depth. Depth. Next, inspect intercostal spaces while client breathes normally. And inspect for use of accessory muscles when client breathes normally. And then for palpation for the anterior thorax is palpate for tenderness, sensation in surface masses or lesions using your fingers. And next is palpate for crepitus as you would on the posterior thorax. Next, palpate for firmitus. Place the balls of your hands with your finger hyperextended or the ulnar surface of your hand on the patient's chest and have the patient say 99 as you palpate vibration of where the firmitus is palpable, increase, diminish, or absent, or same as the posterior technique. And then for the percussion of the anterior thorax is percuse apices per tone above the clavicles, and then the intercostal spaces across and down, comparing sides using indirect or mediate percussion. And note areas of resonance and hyperresonance or dullness. And lastly, for auscultation for the anterior thorax is auscultate for breath sounds, adventitious sounds, and voice sounds. And that's the objective data of thorax and lungs assessment.